Okay, you can start.
Hello, everyone. Hi, I'm Joydeep Gupta. Uh, as you can see, probably that we are doing this webinar. You know the subject, and that's why you have joined. We all know that it's an important subject of how to keep ourselves safe during covering COVID-19. So just a couple of housekeeping rules. One is that you are all muted, and that's part of the software. So whenever you have any questions or for any of the two panelists, Ida and Snehasis, just use the Q&A button. Okay, use the Q&A button and put it there. Don't use the chat button to ask questions. Chat button is for any conversation, other comments or conversations you may want to have, but use the Q&A for to ask your questions. So then the panelists will be able to answer them easily. So I know that we have started late, and sorry about that we have started late. There were some software issues that we needed to sort out. So let's get into it straight away. We have two very good panelists today who know this subject very well. We're going to start with Ida Jooste. We're very thankful to her. She is joining us from Durban in South Africa. Ida is the Internews public health expert, and she has done a lot of media training on issues of public health. And she's been doing, in recent weeks, she's been doing a lot of work on how journalists can keep themselves safe. Snehasis, many of us know, he is the president of the Kolkata Press Club. He is a news anchor in Doordarshan, Kolkata. He is a media trainer. And very recently, he is the co-author of a guide on how to keep yourselves safe, especially how audiovisual journalists can keep themselves safe while doing work on the field during COVID-19. So I'm going to first ask Ida to talk to you, and then Snehasis, and then we'll leave as much time as possible for questions and answers. Just one more thing, and then I'm going to stop and hand it over to Ida. I know that we have a lot of attendees from Bangladesh. If any of them wish to ask their questions in Bangla, please do so. Snehasis speaks Bangla, that's his mother tongue, and he can take questions in Bangla. Having said that, Ida, all yours.
Thank you so much, Joydeep, and hello, everybody. I'm so glad to be joining this very, very important discussion. I feel incredibly passionately about this specific issue, and I hope that whatever we discuss today, and I think that Snehasis and I might be saying some of the same things, that's okay, because it bears to be repeated. I hope you go and share it far and wide. I would like to share my screen and hope that you can see it properly. Oopsie, I missed the wrong one. Excuse me for a minute. You know how it goes. We practiced this and now I did not find the right one. Okay, in any case, I will just do a brief introduction and say that at Internews, we have looked at very many of the aspects of COVID-19, but the safety aspect is one that wasn't quite there right at the beginning in people's minds. It is as if journalists started covering the science, the horror, and all of that, and now there is really a moment when journalists are taking note, and editors and newsrooms are taking note, and they're saying, how can we ensure that we stay safe and keep all of those around us safe while we're covering this issue? So in a moment, I will be able to share my screen. I'm so sorry, we practiced this before, and now, now I have a little bit of an issue with that. I'm very sorry, because I'm sharing the wrong one. Joydeep, if we could just go to you for a minute, please.
Ida, I have your presentation. Shall I share it from here? I could do that.
The wrong one is just coming up at the moment. I'm sorry about that.
Not a problem. I'll share my screen.
Yes, thank you.
Yeah. Is this the one?
Yes, please. Please go from the first slide.
Yeah. Okay.
Just go to slideshow and play from beginning.
Well, I'm clicking slideshow.
Just go to slideshow on your screen, and then you just, once you're on slideshow, you click play from start. Can you see that? You see slideshow? That's right. Now you click from beginning. Thank you.
Right. Thanks.
Wonderful. Okay. Look, I think what I would like to say is that obviously we all know that it's a principle in medicine to first do no harm. And many times we speak like that in terms of journalism as well. First, do no harm. And in the case of COVID-19, I think we should consider first do no harm to ourselves and do no harm to others. Joydeep, can you share it so that the full screen is visible to everybody?
I okay.
Do you see that?
Yeah. Okay.
Yeah.
Yeah.
Okay. Thank you very much. All right. So, please go to the next slide. So this particular graph is well sourced. It's from a credible source, and it shows us something very important about how this virus works, which we sometimes tend to forget. I know there's a lot of focus on the numbers. Many people, just stay on that slide for now. Many people in many countries, in all of the countries around the world where we follow this virus, kind of seem to have, and I include myself in that, a bit of an obsession to keep tracking the numbers. How many people are known infections in each country? We track those numbers, and we also track the number of deaths, unfortunately, in those countries. And we feel as if we then get a sense of how widespread COVID-19 is in our countries. But that's actually a false obsession, because we know very much now from the science, all the way back to those early times from Wuhan and in all of the other countries where scientists have been tracking how this virus works, that it is absolutely perfectly possible to have no symptoms, yet to have the COVID-19 infection, or to have only mild symptoms and to be infected. And we also know that all of those numbers, don't go away, I'll tell you when to go to the next slide, thanks. So that in all of those countries where all of us obsessively checking the numbers, we are only checking the numbers of those who are known to be infected and who have tested positive. We are not seeing the numbers reflected of all of those who are not infected and those who have not been tested. And guess what? As we can see from that pyramid, those with mild cases and sometimes also those with only mild symptoms and those with no symptoms are actually also infectious. So what we see around us when we look at hospitals that are overwhelmed and burdened, and when we think about all the symptoms that we've all come to know so well, there is something that we are missing, and that's the fact that we ourselves, as people, whether we are mothers, fathers, cousins, uncles, grandchildren, grandfathers, whoever we are as people, we are possibly infected, we are possibly infectious. And so are the people we are interviewing, whether it's a government minister, whether it is a nurse, whether it is somebody in the street, a child, anyone around us who looks to us to be healthy. We're forgetting that important point about the science of this virus. So people are vectors. We as journalists are vectors of the spread of COVID-19. So you can go to the next slide. And then we just consider that that, of course, presents an incredible dilemma for journalists, because we are saying, let's do no harm to ourselves. In other words, let's not expose ourselves to the virus, which is why the lockdowns and the physical distancing regulations are out there. And of course, also do no harm to those we are interviewing. And since we can't see who is ill, I'm sort of, in a way, realizing that that presents a dilemma, but at the same time also presents us with major insights that helps us to not stigmatize anybody, because absolutely anybody could be, not only is it not somebody's fault whether they're infected or not, but absolutely anybody around us could be infected. So that is such an important principle to bear in mind. And that's actually the science that underpins why these safety regulations that both of us are going to be speaking about today are so important. Please go to the next slide. So there are a whole number of considerations that come into place once we've grasped and fully internalized that fact. And the one is, of course, and we've seen around the world, that as soon as journalism and media and telecommunication services started to be designated as essential services, on the one hand, I, as a journalist, was excited and I felt validated, because I know that how important in this pandemic, and especially with the misinformation and the infodemic and the misinfodemic about COVID-19, to realize and acknowledge that we as journalists are essential services is a great validation, and I'm sure we all agree with that. But that again prevents dilemmas for us, because it means that we also are expected to play a very specific role. And unlike health providers and doctors and nurses in this response, there wasn't the immediate assumption that journalists should also have protective, all of the protective clothing and all, for instance, masks and other items that are available in some cases to those in the medical profession. So very quickly after that designation was made, journalists started to demand that they should also have masks. And then in many countries we saw that governments and health departments said, sorry, it can't be, we don't even have enough masks for the medical personnel. So again, that presented a dilemma for journalists, but not a dilemma that can't be solved. It simply means it's something around which we all needed to gather information. So in each country, there would be guidance about whether journalism and media, whether those spheres of life are regarded as essential services. In each country, there are also regulations and then also realities about whether those participating in essential services can be helped by getting free masks, for example. So the point, though, you can go to the next slide, is that it is almost certainly the case that there aren't enough masks to go around for everybody. We also know that this demand got us to question whether masks are in fact recommended or not. And I know there has been debate about the fact that at first WHO said it wasn't really so strictly necessary for those who were uninfected to wear masks. It's more effective in preventing those who are infected from infecting others. And then that guidance changed. And then there was criticism about the change of the guidance. But I think as health and science journalists, we've also come to realize that there is so much evolving science about this virus that we know that the WHO and CDC, to name those two really credible sources, are doing their best to find out what the evolving science and the evolving best practice is. So that practice has now, in many countries, turned to, yes, everybody should wear a mask. Everybody should wear a mask when out there in public. So I think then that we as journalists have to say, whether they're given to us for free or not, let's find out the best practice. You can go to the next slide on how those masks should be manufactured, where they should be obtained from. There are, in some places, there's been a price hike in masks. In other cases, masks are being donated for free and are being manufactured at large scale. Nevertheless, just go to the best two sources on this issue, WHO and CDC, and you'll see that there is actually a guide on the CDC site on how to manufacture those masks. So let's go to the next slide. But I want to say that this preoccupation with masks and a bit of a, I don't mean it negatively when I say preoccupation. I was a television and broadcast journalist for many years, and it must be our preoccupation how we gather news and how to safely gather news, whether it is in a war or conflict situation or in this type of conflict situation, because it's almost like similar to conflict journalism. I think that if we are only concerned with whether we should wear masks out there, and only concerned with how far away we should hold the microphone, or only concerned with how to clean the microphone, how to clean our camera lenses, there is nevertheless an essential point that we are missing. Yet it's important to know about all of that. But I want to really encourage everybody to think about something much more revolutionary than how far away is the microphone and how do I clean my equipment? Yes, be fully aware of that. And there's good guidance online and good guidance. I think Snehasis also has very good guidance on that. But I want to actually emphasize that we think of a very revolutionary way. Well, not so revolutionary actually, because mobile journalists and online journalists have been following a lot of these principles for a long time. But I think now is the time for absolutely everybody to think, how do I stay credible as a journalist without going out there to the field, without making physical contact with the interviewee, without being an actual physical witness at the scene? And as an editor, I'm now saying the absolute opposite of what I used to say as an editor. As an editor, if I saw a journalist sitting at their desk, I would say, why are you here? You must be out there where the story is. We know the famous story about how journalists should be in restaurants and bars to pick up on stories, not only to pick up clues and leads, but also to report on stories. It's about being out there in the field. That's our entire DNA as a journalist, is about that. And now we're asking, and now we're saying we should think radically different. What if we were to do these stories without any physical contact with the interviewees and without being the person who physically is the eyes and ears on the ground? Let's go to the next slide. There are ways of doing this. There are ways of doing this and maintaining our credibility. If we look, for instance, at this image from Thailand, where journalists were filming a news event, yes, they are all wearing masks. They probably might be informed about how to clean their equipment, but there is a major mistake out there, and that is the fact that these journalists are still standing too close to one another, and they are too close to the subject that they are interviewing. So what is the revolutionary way in which this could be different and should be different in future? Let's go to the next slide. So among those on the call here today, I think many would be dialing in from home. And I know that most or many newsrooms around the world have instituted, for instance, shift services, or have allowed, or even, I hope, instructed their journalists to work from home. It doesn't mean that we immediately know what to do next. I also am very aware that not everybody has the luxury of a great laptop and a kitty cat sitting in the window and having more than one device to work from. But this is just to act as inspiration to say that a lot of what can be found on the internet and a lot of what's available of the best of social media, I mean, some of the most wonderful advice is coming to us on Twitter. It's also easy to demonize social media when we sometimes forget how much great stuff there is on social media. Some of the most wonderful influencers on this topic, including, of course, the WHO, including journalists like Laurie Garrett, who's regarded as the top social media influencer on COVID-19. They are all posting content. What we're discussing today here is content. There's a story in what we're discussing today. So all of the webinars we're all attending, all of the social media we see are sources for stories that we could be telling about COVID-19. So let's go to the next slide and talk about how, I hope you can see that clearly enough, how in television and radio and online production and with social media, much more can be done to ensure that we are safe and still gather the news. Now, in television, I know a broadcaster, a television current affairs journalist in South Africa, who hasn't, in the past 4 weeks, been out with a TV camera in the streets at all, but he has produced great current affairs pieces. How does he do it? He asks his former contacts, not new contacts on WhatsApp, but his former contacts, to send him either their voice recording, or he phones them on a WhatsApp call, or he asks them to record something, send him pictures and send him videos on the issue that is being discussed. The issue could be something like, how are people coping with lockdown? And it doesn't mean that his stories are all soft or feature type stories. He actually manages to handle hard-hitting stories by simply contacting his former contacts and asking him to send them the material on WhatsApp through audio files, video files, and photographs. In radio, it's been a clear and easy thing to do, you know, for the past 20 years or so. That call-in radio and talk show radio is wildly popular. It simply requires your guest phoning in from home, your interviewee, you phoning your interview, and you can link them up. Yes, there is still the dilemma that most often studios are still required to get the signal out there in radio, but those staff can be absolutely minimized, and so that the actual input or news gathering reporters can all be at home and doing this via telephone. With online production, it's been the case for a long time. Mobile journalists, online production is about gathering sources online. And then I want to say, don't just rely on what you can find on the internet, because it may risk either plagiarism or kind of just repeating stuff that is already out there. As journalists, we always want to gather new information, new pictures, new voices to make our stories fresh. So just use those former contacts, just gather the information from them in a different way. Of course, this means our internet must be stable. Data does cost. Again, hopefully the telecoms companies in the countries where you're dialing in from have already stepped forward and made data costs more affordable. And if not, we can also use our journalism to advocate for that. Let's go to the next slide. And say that so Mobi journalism, or those very many mobile journalism practices, maybe after this webinar, we can also forward you examples of journalists who've really successfully done this for a long time and are able to just take those skills forward with COVID, is, of course, we mean the mobile phone, not the mobile person. So this time around, we're saying the person stays mobile, you, the journalist, stays stationary in your home and gathers this through the techniques of mobile journalism. WhatsApp audio, I think all of those have already been mentioned. And I think it also is a call for us to kind of just ask around and hear how successful Mobi journalists are doing this and crowdsource all of the best innovative practices. Let's go to the next slide. So another example I know of where, once again, we can still be out there and gather fresh news, not just recycle other images and other pieces of audio, is that, for instance, an example I know of, again, in South Africa. I know these examples better because I happen to live here, but look for examples where you are as well, is that, for instance, in terms of court reporting, what has happened is that through agreement between the South African National Editors Forum and media houses out there, the agreement has been that only one media house would be let into the court, that they would record the proceedings, and then this is available for share. So this is a way of media houses kind of clubbing together, competitors even clubbing together for the sake of everybody's safety. All those in court and all of those journalists who now no longer need to be exposed to an abundance of people. And yet the court reporting is still accurate because it's still the same court proceeding. So you can just apply this example to so many other areas of life out there. Of course, it means that editors must buy into this, must fully appreciate this. Editors and media owners must fully appreciate the need for this. So I would say for those working in organizations and associations which work on media freedoms, which work closely with editors, and if there are editors on the line, please do consider, you know, a formal revision of editorial guidelines to help journalists kind of navigate this difficult path of how to stay safe while on lockdown with COVID-19. So let's go to the next slide. So I think apart from gathering the fresh information and telling those stories in the ways that I've just described, I think there's also a great opportunity for journalists to really practice that skill that journalists uniquely have. And perhaps those who are now all able, you know, on social media, everybody is a content creator and everybody can post, as we know. But journalists really have the training, the background, and the skill to know how to make meaning of events. So this is really a golden opportunity in a way for journalists to use that meaning-making skill of theirs, connecting the dots, putting different, you know, making comparisons across countries, for example, comparing what a prominent figure has said now and compare that to what he or she has said a month ago, and making meaning of that story, still telling the COVID story, not necessarily even gathering new information, but using our minds to make connections and connect the dots. So go to the next one. And I just wanted to say, obviously, staying safe isn't just about staying physically safe, but the whole, you know, misinformation, the epidemic of misinformation that we have, and the fact that people are fearful. It's really scary. And there's a lot of new information out there, and people are trying to make sense of it. So I'm sure none of us have ever been on so many WhatsApp groups before and have never received so many WhatsApp messages, and of course just the abundance of misinformation, which is an indication of the extent to which people are trying to understand this, trying to provide solutions, maybe trying to get over their fears. So unfortunately, there are also those malignant actors who are playing into fears and biases. So this abundance of sharing, this kind of online life that we have now, this webinar here would not have happened, you know, 2 months ago, has also created an opportunity for more hacking, for more of, you know, for us to need to ensure that we are digitally safe more so than ever before. You may have heard the hacking of Zoom. We're all talking on Zoom now because Zoom has then also responded and made the platform safer. Let's go to the next slide and remind each other that it's not only via social media that this misinformation happens. So as you see on the next slide, mainstream media is also, so just go to the next slide. On mainstream media, there is equally, you know, just an abundance of information that is confusing to the public. I'm not suggesting that prayer is bad, but we do know that it will not be the cure for COVID-19. Go to the next slide. Part of staying safe to me is a bit about staying sane as well. And to stay level-headed means we do need to work harder even than ever before to protect ourselves as journalists from this misinformation, because we could be an amplifier of misinformation if we're not absolutely sure how to navigate this area. So one kind of hashtag that I always think of is that if you get something and you don't know what the source is, just don't forward it. Don't actually, it may be noise that distracts from the bigger story. Consult those resources that are available on how to debunk myths, and then also do not only a fact check, but an actual reality check. We often phrase it like that at Internews because we need the right facts, but we also need to consider why is it that people believe the things they believe. And perhaps we'll have a bit of empathy from them, or we'll have more of an insight on how to counter those pieces of information that people seem to believe, even though we can't quite understand why. Go to the next slide. And say that staying safe is also staying safe in terms of our own mental health, obviously. It's unprecedented that so much negative news, so much information that makes us feel insecure about the future happens across our screens and in our brain every single day of our lives. So there are organizations, you can simply do a Google search and search for mental health and COVID-19, and you'll find lots of resources. But I think journalists particularly are actually even more exposed to it than the general public. So just take care, take breaks occasionally from COVID-19. I think we do all need to. And I think many of us have felt this increased impulse to connect with loved ones, and that's a good impulse to act on. And the next slide is just how I would like to wrap it up and to say the only way to stay really safe is to stay at home, but of course equip ourselves with the tools and the skills to remain credible as journalists. And there are lots of questions that arise out of all of that. I've put them on the next screen. If there's time, we can handle them, or you may, I know that also your own questions are coming in as the two of us will be talking. So thank you so much.
Thank you, Ida. Thanks a lot. Right. I found it very useful. I'm sure all the participants did, but we are running late, as Ida pointed out, and I could see that she was trying to wrap up as quickly as she could, rushing through. So let's go straight to Snehasis. Snehasis, over to you.
Thank you, Joydeep. Thank you, Ida. It has really given us a great opportunity to go for this kind of webinar because this is very useful. I believe that just give me a moment till it comes. I'll just do just enable to full screen ki kore korbo, right? Go to I approve the No, no. Joydeep, would you kindly do the same thing, or I'll just now it's in the whole screen. Can you hear me, Joydeep?
Yes, we can hear you, and it's showing as full screen now. No problem. Go ahead.
Okay, I'll just check. Okay, now this is the title slide. I think there are many things which Ida and I have common, so I'll not go for that. I think the crux of the matter has already been explained, that we need to remain safe. We have no reason to make others unsafe, and we need to know how we can work from a distance. So definitely our goal should be to cover news, not to be news. If something happens to us, we will be not as a byline, but not as something else to become a headline, which we don't want. And we should know that we should not go for that. So that is very important. I would just like to mention that we have covered general strikes, riots, curfew, terrorism, public unrest, fire, house collapse, natural calamities like earthquake, even tsunami. We have covered diseases like swine flu, dengue, plague, SARS, and many other crisis situations. But we had no experience of what is happening now with the threat of spread of dreaded coronavirus. So this is something new, and the journalists need to be active in a slightly different manner. We need to address a slightly different. So what is our responsibility as a journalist, as an individual, and as a citizen? We have a responsibility towards own self, we have a responsibility to our family, and we have responsibility towards society at large. So which means that I need to remain safe, and I cannot make my immediate family unsafe, and I cannot do anything that I'm instrumental in spreading the virus, and I do not become the entire society vulnerable. That is exactly what I said, that Ida has also mentioned that we have been made as a part of the essential services, but that does not mean that we can move anywhere and elsewhere. We also need to scale down our human resources, which means that we actually can work from home on some days, and maybe in a week, 2 days, you are bound to go to office for several other things, depending on the facilities available in your own country, in your own workplace. But no matter where you are, we can scale down our human resources, and we can do it from a distance. That is exactly the crux, and we must know what is lockdown and the social distancing. The journalists are to go. I mean, as Ida has explained, that yes, our thing is, what are we doing in the newsroom? We need to go to the field to collect information. But now, as she has explained, we call it a remote recording, distant recording, and the video conference. You see, where I am in the city, the chief minister of the state does a video conferencing on every other day or so, and the journalists are not present over there in that particular place or in that particular room. And we get the material, the video, and the Facebook and other social media uploaded. So I can receive all these things sitting in my workstation, and I can act accordingly. So video conference, providing video output, Facebook Live, and I give you an example that we have had certain stories made by certain channels on reactions of important people, celebrities on being locked down. So instead of going to each and everybody's place, they have requested them to record and send them the video, record in the mobile and send them the video. And they have done it, and one has compiled maybe from somewhere else and just placed it to the playlist and sent it in the server, and it was being played. So perfectly all right. So the remote recording, the distant recording, and as it has already mentioned, that we don't bother about quality at this crisis moment, at this trying time. This is the time our most importance is on safety, not on quality. And sharing the visual, and as she has been given an example of court reporting, we do a lot of places where physically 50 camera persons cannot stand. So one or two goes there, and then on the condition that the person who has been allowed will supply it to the others. We call it a pool. So in pool, one goes to event number 1, 3, and 5, and the other team goes to the event number 2, 4, and 6. So this is a pool has been made, and then it is being distributed, that she has rightly said. Now, what we do in case of covering the vulnerable areas like hospitals, unfortunately, I have seen people standing in the queue where many people had come to the hospitals to get themselves checked whether they had coronavirus attack or not. But the journalists were, especially the television journalists, were holding the microphone and asking them, how would you feel if you are detected positive or something like that? What makes you come here? That did you have any record of foreign travel or etc.? So all sorts of questions were being asked. So now my point as a television journalist is, can't we manage with an establishment shot and a voiceover of all this information? Or we can stand in front of quite away with a background shot of that hospital or of the building and do a piece to camera. That means a journalist is narrating all the information which he has gathered. Instead of going there, he gathers information from a distant facility, and then he stands away from that with a background shot and narrating the information which he or she had gathered. Now, taking interview of the suspected patients from queue is a big safety threat, not only for the reporter, but for many others in the chain. So these are certain things we need to understand properly. And then there are personal hygiene, like hand wash. We know, I need not repeat, it is being broadcast, telecast, and it's being carried in the newspapers, magazines, social media. So we know what is the procedure with the 20 seconds minimum, and the use of hand sanitizers with a 60 or 70% alcohol. And another thing I would like to add, which I think Ida will also vouch as a public health journalist, that we should not remain empty stomach while walking, because that's the time when infection could be coming in, and the vulnerability is much more. So we need to be on a full stomach as far as possible. Now, what we do, those who are supposed to go out, who are compelled to go out, what we are supposed to do on return. First thing is, we must wash used clothes, maybe in warm water or whatever it is. We must put our shoes outside, keep our purse, cell phone, watch, notebook, comb, car keys, office keys, etc. separately at the entry point. Take bath on return, use certain antiseptic lotions and all, and don't go close to the children and the aged. And maybe we remain in our study, maybe we remain lying on the sofa on the living room, at least the days we are going out. So these are the personal hygiene, because we also have a responsibility to our immediate family. We cannot take any risk. Now, the mask, a lot of things have been discussed by Ida on this issue. I do not want to repeat, but one thing, it depends on the order of the authority of the government. Now, the place where I stay, the government has ordered just the other day, whoever is going to the public will have to have a mask. Now, whether N95 mask is available, how much does it cost, how long would it be usable, all these questions are there. Whether it is very useful for those who are not going to the patients, to immediate closeness and all, that's different issue. Now, the government has announced and we need to abide by it. And the personal health also, we need to understand that most of the time we are on call of the duty, and we are chasing news, and we don't often care about our own health. Now this is not the time when we can be so reluctant to our health. Now we must take care, especially at this crisis and a critical moment. If you develop cough, cold, throat pain, fever, or any other symptoms like corona affected, please contact the doctor, and your media authority may have to go for isolation. May not be for you. This is required for others. If you might have got uh, by some means or other, or you have become symptomatic, then it's better not to take the risk. So that mentally one has to be prepared, since we are going out, since we are going to going close to some people who are close to the vulnerables, maybe not directly but indirectly. I'm not going to the hospital, but one of my colleague has gone and visited the hospital, took an interview, and in the newsroom I'm working in the next workstation. So then I must be mentally prepared, and I told my colleague I should tell him to understand and not go inside the hospital to take the interview, to do it for a remote recording, and to do it by something else. And our personal practice also, we need to change that. Uh, we need to keep a record, those who are going out, that for last 14 days, where all the places we went, whom were the people with whom we came into contact. So this is very important. It will be helpful for contact tracing. In our country, the government, the union government, has developed an app where we are supposed to download, which will help us in keeping our contact tracing available, making it possible. And inside the office, there are certain places I may not be required to PCR. I'm a reporter. I basically work in the assignment. I have my own workstation, may not be in the newsroom, maybe in the bureau, or maybe in my own chamber. Otherwise, just to see the bulletin going on live, I might go on the other day, but no, this is not the normal. I should not go to the editing room, not go to the PCR where from the bulletin is produced, not even go to the studio where I am not exactly required. In those workstations, I should avoid. And the pregnant and aged should opt for work from home. They are, in our government has also said in many media, if you are really aged and you are carrying, then obviously you just inform them and you can work from home. And there are a lot of stuff to work from home, and you can in this digital age, because as we are doing this webinar, you see someone is in Durban, one is in Delhi, one is in Kolkata, and someone may be joining from Bangladesh. So you see, it's possible. The digital technology has made this possible. So media should adapt it, because as Ida said, that social media has been working on this. And the personal health norms of the journalists will depend on the overall situation of the pandemic in the area where he or she is working. So my norms, health norms and safety norms will be determined in the area where I am working. And obviously Joydeep's safety norms will be determined by the authority where he is staying and he is working from. And Ida's obviously will be done in Durban, and Joydeep's in Delhi, and in Kolkata. So obviously we need to know that we all need to abide by, and they may change it. Till the other day, we were not forced and we were not made compulsively using this mask, but now in my area, our government has announced it that whoever is going out should have masks, then I should have masks. So that is it. So this norms might change depending on the directions of the competent authorities of that particular area, which will depend on the vulnerability of that particular area where we are working. Now I come to the microphone, as it has also mentioned that firstly, keep more distance between the interviewer and interviewee. Now, the first and foremost thing, we should go for distant recording. We'll ask them the questions, give them the questions, they should record and send it to us. Or we'll use Zoom or any other, for that matter, live apps or live softwares where Skype or Zoom or which are being used. There are plenty. Or else they record in their mobile phones and give it to them. We could give them a little bit of instructions. But if we are physically recording, now this is a normal condition, the picture you can see, but no, this distance should be far away. You must use a boomstick, and so that the distance between the reporter, the cameraman on one side and the interviewee on the other side should be more. The 1 meter minimum social distancing norm should be maintained. And we can carry a tabletop microphone and we can use it for them, because tabletop, I place it and I go back and I record from a distance. So this is something, more distance between the interviewer and interviewee. As far as the use of microphone is concerned, you can see in the slide that there is something called head basket, which is kept over the microphone, over the head of the microphone. It has got nothing to do with the microphone. It's just like a cover. It is removable. You can remove it and you can clean it separately. And inside also there is a certain sponge being used. You should change the sponge or clean the sponge, because this is one place, one piece or one instrument which gathers infection, the virus, because coronavirus is moving through droplets. So if somebody speaks, the droplets come out and it can stay there in those baskets, and from there it can go to anybody else. And the body of the microphone will also have to be used by a cleaner or alcohol-based cleaning solution. Now we also have lapel microphones or lavalier microphones or collar microphones. We would put it in the necktie or the collar. That is basically to be avoided, because that brings someone of you in the crew to go close to clip it or something, or it's quite close to the mouth, and then when it is being returned, it's accepted, received and carried. So it goes closer to the mouth. So for the time being, this may be avoided. So the head basket you can see, and my request to the audiovisual or audio journalists who are using microphones, please, we have never been doing this in normal time. Maybe our colleagues are reluctant to do it, but that puts us in more vulnerability. So we have to be very particular that after the coverage, this needs to be cleaned as we have been showing it, and microphones are to be cleaned also. And the other equipment like camera, lights, which are required for the coverage, if it is required at all for physical kind of a coverage, then obviously we need to clean it. But it is possible for video conference facilities or recording of a press statement, media statement in the mobile, and being passed on to several users, or put it in the social media or the websites of that particular organizations, which can be downloaded and used. And the Facebook Live or any other thing live is available at live and can be put through to the live transmission of various television channels. But if we are using, we must be extra cautious in cleaning those materials. Well, cell phone is an integral part of everybody's life, more so to the working journalists. And this is another vulnerable equipment. We must not forget that the cell phone, we put it like this, and you handle it constantly and often press it on the side of your face, and it can cause bacteria, virus, and other germ comes to this phone, and which could be easily transferred to us. So the disinfectant wipes are safe, and spray a non-abrasive or alcohol-based 70% or more isopropyl or disinfectant, anything, soft lint-free cloth, and wipe down your device while it is powered off and unplugged. So these are the small things which you need to do it regularly, and especially when you come back home. And it is said that use of paper towels are too abrasive, but the safest and most effective way to clean your screen is a microfiber cloth, and the best solution of removing sand and lint in Scotch tape. And for the smaller and speaker holes, use a toothpick or try to vacuum with the debris, or you put a toothpick to those holes. So we must make it a point to clean this at a regular interval. This is it's 24/7 we are using as a journalist or normal persons. And since we keep it somewhere in somebody else's workstation and things like that, this is a major carrier. We need to take care of this. And I see 8 things you should never use to clean a cell phone: the window cleaner, kitchen cleaner, paper towels, rubbing alcohol, makeup remover, compressed air, dish soap and hand soap and vinegar. Obviously, this is not a demonstration of a mobile telephone company, so I should not go on details with this, but this is because if mobile phone goes conked off and it is not working, then as a journalist at this moment, we are gone. We cannot survive. This is our survival kit. And stay well, keep well others, even covering corona. We need to cover, because people need to get right kind of information. So our services have been made essential, and we need to provide right information, and we need to provide it well packaged and well written form. So we need to work. Can work from a distance. We can work from home. But if we are going out, we have discussed, both of us, that what are the things we can maintain. Yeah. Thank you. I think Joydeep and Ida, I think I could do whatever little I could. Thank you.
Thank you very much. Thank you very much, Snehasis. That was very detailed, and I'm sure it was very useful for, especially for television and audio radio journalists. Good. I'm looking at the questions, and I can see the questions, and I'm going to read them out, and then whether it's Ida. Yeah, Snehasis, you can stop sharing your screen, but please stay online because there are questions. Okay, so the right.
Am I all right? I believe.
You're fine. Okay.
Thank you.
Now the first question is to Ida. Is from Vishal Gulati. It says the COVID-19 pandemic is inflicting major financial damage on media organizations. Managers may find it hard to reverse the fall in ad revenue and find new grants. So what's the sustainability advice? That is a more wide question, I suspect.
It's a more wide question, and if you can all follow the chat, I've tried to, I don't say answer that, but to respond to that by saying I absolutely do not know the answer because I'm not an expert in that field, but just to be assured that all of the major media development organizations in the world, and including Internews, are looking at this issue really, really closely, because obviously we're all concerned about truth-telling, and you can't have truth-telling if you don't have journalists who are employed to do that. So I do not have the answer. I know it is a very, very serious issue. And I know that already inside Internews, for example, and I'm sure very many other organizations, there are discussions on how we can share what we managed to find out also more broadly on a webinar like this. So I think just stay tuned for that. It is a very serious subject about which I don't know enough.
Okay, fine.
If I am allowed to.
Yeah, Snehasis, go ahead. Yeah.
Well, every day by day, we have been getting information which is alarming. Journalists have been told not to come. They have been asked to go for leave without pay. The downsizing has already started. Pay cut has already started in various mainstream, well-established media on one side. As we all know that there has been a downfall in the media industry going for several years. This lockdown, this COVID-19 will kill various jobs in various other sectors, including the media. Media has already become its victim. So for individual, what I can say, we need to develop ourselves as content writers, content providers. There are various other areas, industries, services who will require content. Every industry requires content. So the diversification is the answer. We need to do it, and the social media platform is the answer. Now, the revenue model of social media platform is a different question altogether. Yes, there is a revenue model. So two answers I can initially think of, though it is too initial. One is to practice content writing and to work for various services and products and organizations, and to make one's presence felt in social media. Social media also has a revenue model. Thank you, Jody, for giving me this opportunity.
Thanks. Snehasis, there is a very specific question for you, and so I'm going to read that out before going to the wider questions. So this question is from Saurav Gupta. Asks if it's feasible for journalists to use the PPE that doctors use.
Well, again, my take here is if the authority of the country or the state asks you to do it, then only you do it. There is a shortage of PPE, and making PPEs available in adequate numbers to the doctors and frontline service givers like the paramedics, nurses, OT attendants, and those who are dealing with COVID-19 positive patients and the patients in the same hospital. So the first priority is to them. Yes, there has been places, even in India, the journalists have been seen wearing the PPEs, but I think there is a shortage of PPE, physical shortage of PPE. I don't think unless and until WHO, CDC, or the renowned agencies and the authorities of the area, like state or the center or the country, makes it compulsory, and those who are not going inside the hospital, my point is, why should one go inside the hospital and go closer to the person to get the interview? Time has come to use other digital technology. Yes, so that is my take with PPE. We have to understand that those who require it more should get more. We are influencers, and that we get to manage PPEs. It's not fair.
Right. That point of influencers segues me into the next question, actually, which is for both Ida and for you. The question is, once this lockdown is over, what would be the role of journalists in convincing our audiences to keep physical distances still? Ida?
Yes, shall I take it? Or Ida?
Okay. Thank you. That's a great question, because I think all of us are going through, questions in our mind, how long the strictness of the lockdown will endure. And we also understand from the science that even if governments lift some of those restrictions, that the danger will not be open. And then our role is actually even more nuanced and even more important. I would say one of the ways in which we can do it is that our stories, of course, change and shape norms. And so if we continue to write those stories that illustrate how successful lockdowns have flattened the curve, or how other countries or even vicinities in our own country have been able to restrict flatten the curve. I mean, change the trajectory of the epidemic by maintaining good social distancing. I think that's inspiring to people and gives them something to aspire to. That would be one way of doing it.
Right. Ashish, you want to say something?
I would just reiterate what she had said, that covering the best practices, giving examples of two countries and making a comparative story that country A has done it while country B has failed. And we need to follow country A. And if we don't follow, we will become country B. And we need to gather information, what is to be done at the time of after lockdown. Obviously, there will be advisories from the competent authorities like government, medical boards, and things like that. And our duty is to transmit and create an awareness by virtue of our media, package it well, package the information well, repeatedly transmit those messages so that people understand the necessity of social distancing even after the official ban is over. So creating awareness is our duty, and we need to follow that duty because our role is very important.
Yeah, thanks. Okay, now I can see two sets of wider questions. One, actually, I'm going to answer immediately is by saying that we are going to take up the subject in another webinar. There are questions on how do we as journalists tackle the spread of fake news on COVID-19. I can tell you that the Internews Journalism Network is planning to take up this issue in a webinar pretty soon. Please do join. And next week, in fact, there will be a webinar similar to this as well as handling fake news. That is just like this one, the timing was made to suit journalists in South Asia. The one next week will be made to suit the time to suit the journalists in East Africa. But given that that time difference between South Asia and East Africa is not much, I'm sure all of you can join, and please do so. We may actually take up the issue of fake news there. That's one thing. The other set of questions that I'm seeing is that, and this probably needs a little bit of explanation to those who are not in South Asia, based in South Asia, is that we are also seeing a lot of unrest on the streets among daily wage earners whose incomes have come down to zero, and many of them are migrants who wish to go back to their villages and are not being allowed to do so under the rules of quarantine. And it is a very difficult situation, and we are seeing flare-ups with some regularity. There were 2 flare-ups yesterday in 2 parts of India that we all know of, and that was reported. And the questions that I'm seeing is that what should we do when there are such flare-ups? To that, my answer is very simple. We are reporters. We should be reporting them. We should be reporting them factually. And having said that, I'll turn it over to the 2 panelists, first to Ida and then to Snehasis, to say what they wish to say on this subject.
I think let me pass to Snehasis first because I had a long time before.
Yeah, okay, Snehasis, you first.
Thank you, Ida. Well, you see, my belief, my schooling in the public service broadcasting may be slightly different. Yes, as I said in my presentation, that we have covered social unrests, we have covered ethnic clashes, we have covered certain other arson and public unrest. So our main role is to pacify that. It's no point to instigate the violence once again. In one side, we need to cover, we cannot leave the story. But at the same time, our approach should be positive, that suppose in one place there has been a gathering of migrant laborers, not knowing that no train, no bus, no arrangements are being made to take them back to their home states. But for some fake news, for some information, but some maybe by some group which wanted that unrest, or maybe for some reasons it has taken place. So we cannot neglect the story, neglect the news. We cannot suppress the news, but our presentation should be very positive, that going through our presentation, there should not be instigations that there are the same kind of things erupt in various other places and it becomes another endemic. So it's an approach. At this hour of crisis, we should not add up anything. We need to understand this. On one side, there's a balance, for the balancing act has to be there. On one side, yes, something has happened, we need to cover that. And on the other side, it is our responsibility to see that it does not flare up and it does not recur in various places. So our approach should be that. This is my take. I don't know, many people maybe agreeing, may not.
Yes, I just want to say that obviously the dilemma is that the people who are protesting or expressing their displeasure do need their voices heard, and they have a valid point. But first of all, in us getting too close to that, we could actually be, we've all experienced this as journalists. You get closer to something with the camera, the protest intensifies. You get closer to gather the information and people get more angry. So again, it's one of those instincts that's runs a bit counter to the way that we've normally been doing things, but we do have to think of first, do no harm, just as Snehasis has said. So in other words, in a case like that, if I were physically in the vicinity as a journalist, I would take a picture from the distance to document that this has happened. And then I would try and find out, usually if there is such a protest, there is somebody in civil society, some human rights activist who's well aware of the issues, and really try to highlight the issues and say that people have voiced their their concern and their need for a solution. But rather than getting so inside of it, we need to focus more on the issue and perhaps have file footage if it is about housing, if it is about general refugee problems. We have, as Snehasis has already said, other ways of depicting the issue. Remember, it is actually ultimately about an issue, not about that one event. The issue has been there for decades possibly and will remain, but we don't need to reflect that actual moment as intensely as we used to reflect it in the past.
Thanks. Okay, we have very little time left. In fact, we have run over time. So I'm just going to take the last question now because this is an important one. It's come from Bangladesh. It says, millions of jobless poor people are leaving their homes to look for food. They're not maintaining any physical distancing, and they often do not have any access to any media outlets. How do we ensure that hygiene messages are conveyed to these people? Who wants to go first?
I know it's a very tough one. Yeah, it's a very tough one.
Yeah.
So I'll just give some of the examples of what some of my colleagues who work on our humanitarian information services, what they are doing to try to address this, is to just acknowledge that obviously when people don't have access to mainstream media, there is a major challenge. But you would often find that people do have access to, for instance, a form of community engagement, or that there are people who do get to communicate and hopefully also even do two-way communication between that community and somebody with information, and to then ensure that the same safety messages land with that person. So rather than thinking of here's a radio station with its signal, or a TV station or a print press that gets to people, rather think which individual of which organization does get to those people, and ensure, just do whatever we can, even just from a personal capacity, to ensure that those people have safety messages and have responses to their questions.
Right. Snehasis, I'm sure you know of similar situations. What would you say?
Yeah, I would first like to, through the person who has asked this question, to greet the new year, though this is not the right time to greet New Year's from that country and to the part of the country where I am in. But yes, that's a fact of the matter that we are going into the new year with all those problems, but we wish that we will be better off in the coming year. My New Year's greetings to you. But the next question is, there are people, there are plenty of media. Bangladesh has media plurality. So you can access to one of the media outlets or various organizations, the presence of international organizations, NGOs. There's a huge network of NGOs there in Bangladesh. International aid organizations are there in Bangladesh, or civil society is very much present in Bangladesh. Firstly, you raise the voice of the protest to the competent authority. This is number one, through NGOs, through aid workers, through various other ways of civil society. And the next is we need to display this message of social distancing. Yes, when people are hungry, it is whichever part of the world is immaterial. Hungry people will not be able to, it is the hunger which compels them to come out on streets to say that they are hungry. So we need to give this information that it might be hunger which may not kill you, but it could be the disease which will kill you faster. So you need to maintain social distancing. So that kind of awareness campaigns, I have full faith in the NGOs and various other organizations, civil societies, and the government in Bangladesh. This information needs to go to the proper people so that they can initiate such activities, so that the people get food and ration and also remain inside and do not gather and maintain social distancing. Yes.
Thank you, Snehasis. Right, I know we have to wrap it up now because we've gone over time. I'm very happy to see that we have had participants not only from South Asia, but also from many countries in Southeast Asia, in Africa, and in Europe too. I can see participants from Europe. And of course, thanks a lot to our colleagues who have got up very early in the morning in both North America and Latin America to make this technologically possible. Thank you very much. And as has been written in the chat box, we will continue to have webinars like these, important webinars. So please keep a lookout for that. Thanks. Bye.
Thank you. Thank you.
Thanks, everybody.
Thank you
Have a
very
good
much
day.
for this opportunity. Yeah.
Yeah.